Okay. Julie Hodney, let's see, Dr. Heim. Okay, I'm sure she's running behind with patients. Is Art, are you on?
I don't see Art.
Okay, well, in the interest of time, and since we got a little late start here, I know we do have a quorum. So let's go ahead and call the meeting to order. First on the agenda is approval of the agenda. Does anybody see anything? Are there any additional updates that we need to add? Oh. Okay, I see. Is that Dr. Heim that typed that her microphone doesn't work?
Can you hear me now?
Yes, yep, great. Okay. Does anybody have any additions, changes to the agenda? Otherwise, I'll take a motion to approve.
I'll make a motion to approve the agenda. This is Julie.
Okay. Any
And I'll
second?
second that motion.
Okay. All in favor, say aye.
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 Okay, moving on, approval of the minutes. I didn't see anything in our last meeting minutes that I thought needed to be changed, but any discussion, anybody else see anything? No? Okay, can I get a motion to approve the minutes?
I'll
So
make a
moved.
motion to approve the minutes. This is Julie again.
Okay, motion from
And
Julie,
And I'll second that.
second from Dean. All right, all in favor to approve the minutes, say aye.
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 Okay. Okay, next item, we have to set our next meeting date. And this would be our regularly scheduled meeting. Now, this doesn't mean that we couldn't, in emergent situations, set something sooner. But just for regularly conducted business in the month of January, it seems like Thursdays at noon have been working fairly well for people. If we want to stick with that, it would just be a matter of the second or third Thursday, whatever fits with everyone's schedule. I don't foresee any traveling conferences that could be, obstacles, but Carrie or Megan, if there's anything that you guys have conflicts, Sarah?
I don't anticipate any.
Okay. Do we just want to say that second Thursday?
14th.
If you say so, I can't get my calendar to come up. January 14th?
Yes.
Okay. All right, let's set that January 14th at noon. Okay. All right, moving into the agenda, our first update is under public health nursing, our current COVID-19 update. And I guess before I turn it over to Sarah and Nikki to give us some information, I just wanted to share, apologize, there's noise, my printer is going crazy in the background. I just wanted to share some information that I put together last night. So I'm going to share my screen here. Can I get that enabled, please? I asked Dalton about that earlier today. Carl or Dalton, if I could be able to share my screen.
Carl's working on it.
Okay. Then why don't we, again, in the interest of time, Sarah and Nikki, if you guys want to jump in, and then I'll go back and share the, oh, okay, wait, I can share it now. So let me. Okay. All right, is everybody seeing me
Yep.
or are you seeing my screen?
You and your screen.
Okay, can
Yep,
you,
I can see both.
okay, can you read what I have up there?
Yep.
Okay. All right, I just wanted to kind of lay everything out. You know, everything's been increasing so rapidly in the county. I think we all feel a sense of duty that we need to really do whatever we can to help curb this, what's happening right now in Carroll County. So I went back through all of the data that we've had countywide from the beginning of the pandemic. And I thought I wanted to just put this, you know, in a graphic so it was easier to digest, and then kind of lead into our discussion after Sarah and Nikki also add to this with their update on what we could do with our mitigation recommendations moving forward. So just wanted to point out that this morning, our 14-day positivity rate in Carroll County was 27.1% as of 8 a.m. Now, obviously, we all know that that shifts throughout the day based upon tests being reported back in. But I believe the CDC recommendation for having schools open is about a 3% positivity rate, which the state of Iowa, you know, set different criteria. But just to point out how high that positivity rate is right now. I went back through all the data from what we've been reporting through IDPH to show how our positive rates have increased in Carroll County since the beginning of the pandemic. And you can see, you know, we had that one test and that one positive in the very beginning, all throughout the month of March and basically April, where we sat at just one. April and May, a couple more trickled in. We really, you know, I'd say, you know, we kept our curve pretty flat all throughout the summer. And then as we hit August, about the middle of August, then we started to see this trajectory going. And if you look from the last 30 days, our line for the number of positive cases, our trends are going just sky high. It's pretty exponential spread at this point. Also wanted to share where we're sitting at from the beginning of the pandemic, looking in a chart, the number of deaths in our county. And it's really sad if you look at, of course I can't have my pointer here. In the last 30 days, we've had 10 deaths. And that is not a good trend that we want to continue. So in the last 30 days between October 12th and November 12th, we had one shy of 700 cases of new positives in our county in the last month alone. In that last month, we had 10 deaths. And this is just a trend line looking from the past. I started using data from October 16th. Daily case counts. Now, these numbers are going to be just a little bit different from what IDPH, because when they do their daily numbers, it's based upon a certain 24-hour time period. Then sometimes that takes a little bit longer to get into the state database and get reported to Carroll County. So these numbers could be one or two off a little bit from what is going to be reported in the state database. But you can see that from about middle October until now, our daily case counts, they're not sustainable. For public health staff, this is not sustainable. Today alone, it was what, 63 new cases. And then again, oh, I gotta move. Between 8 a.m. November 8th and 11:30 a.m. today, I counted up 229 positive cases. So this is just breaking that down further. I told you what the 30-day total, but this is just this week alone, how many new positive cases we had in Carroll County. That 5-day total was more than the county recorded in the 5 months from mid-March to mid-August. And of course, these increased cases lead to increased hospitalizations. We're hearing about this all across the state. We are hearing about this locally with our 2 hospitals within the county. And if you look at, just want to bring up this website, only 30%, actually it's less than this right now. I just checked a couple minutes ago, but we are involved in RMCC Region 1 through the state, that they've divided all the hospitals into different regions. So we go off of this region specific data, which Carroll County is included in. And if you just scroll down, you can see how many people are hospitalized, how many ICU, how many admitted. But this number right here is where we are very, very concerned. 28.61, only 28.61% of total inpatient beds in this entire region are currently available. Got to go back to my other screen here. Oops, sorry. That went back. So this, I think we all know, this is not just a public health crisis. This is not a healthcare alone crisis. This is not a St. Anthony crisis. This is not a Manning Regional Healthcare crisis. This is a county-wide crisis right now. We have daycares that are shut down. We have businesses that have shut down because they don't have enough staff that can operate the business because their staff are sick. It's just a trickle effect because the daycares are shut down. You have people that are healthy, but they can't find anyone to watch their kids. And so they can't go to work either. We have to do something right now about getting these numbers to go back down. So what we can do in Carroll County, just to start the discussion, you know, that there have been a lot of different thoughts on effectiveness of masks in the beginning of the pandemic, but it's been clear as data has been developed, as this has been researched, more months and more data, it's very clear that community masking is having a tremendous impact on reducing the spread in the county. So I just, getting some feedback there from somebody's phone. Just wanted to point out, there's two different studies here. There was one that was just released this week from CDC that's very conclusive. It's statistically significant. It's passed all the thresholds for information that you can be assured is valid and correct. Additionally, there's another study here that was just released from the state of Kansas, and it shows some counties in Kansas decided to have a mask mandate and some didn't. And through the months that have passed, it's been very clear through this data that the ones that had a mask mandate or mask requirements in place reduced their numbers. You can't get rid of it, but you can. The research is showing here that the spread can go, you can, sorry, I'm mincing my words, you can flatten the curve. So let me get back out of here, go back to my PowerPoint. Okay. This is just information I took directly from that CDC study. I just put it in here because I pulled it directly from there. Just wanted to point out at the end, Dean, when you're talking with the supervisors tomorrow, the last sentence on here is an economic analysis using US data found that given these effects, increasing universal masking by 15% could prevent the need for lockdowns and reduce associated losses of up to 1 trillion or about 5% of gross domestic product. Now, obviously that's, you know, we'd have to go back down to what that level would be for Carroll County, but it does show that there is impact. So just to, I'm going to stop sharing my screen for now. I have up, when we get to the point of talking about this again, with our recommendations moving forward, I have written up some information that I'd like to discuss a little bit more that perhaps we could release, put on the Facebook page or just, you know, to the general public about what our recommendations would be countywide. So I guess with that, if anybody has any discussion or if Sarah and Nikki want to jump in and give more updates of what we're seeing today with COVID.
Hi, it's Nikki. Becky, I just want to say thanks for putting that together, and I agree with everything you said. You know, we thought we were busy 2 months ago when we had 30 new cases a day, and now, like you said today, it's 63 new cases. I think we've hit a new high almost every day the past 2 weeks of new cases. And even with the county hiring contact tracers and us working on it here at Public Health, we were still almost 100 cases deep at one point, just because of the volume of cases that are coming in. So with that, just an update on the recommendations from the state, effective Tuesday, I believe it was, they their contact tracers were thousands of cases behind. So they went to only contacting household members of a positive case. They weren't going to contact trace. They said that's not what they wanted to do, but it's what they needed to do to get back caught up. So that's scary. You know, all these efforts that we've put all of these months is feels like it's kind of going down the tubes again, just because we just don't have the staff or the time to do the contact tracing. So we're just going to do the best that we can for now. You know, hopefully in a few weeks that goes back to how it was, but I don't see that with the increasing numbers just day after day after day. And then I just did want to point out, 15% was the threshold for the schools all along. Well, we've been above that 15% this whole time, which now I think we're at our all-time high with that too at the 27%. But just an update, there's only 5 counties in the whole state that are below that 15%. And 3 of those counties are at 14.9. So there's only 2 counties in the whole state that are 8.7% and 9.5%. So it's scary. And, I think we do need to do something, because I feel like our efforts are being lost. People aren't listening. Our nursing homes don't have staff. Our hospitals are losing staff. Our clinics are down nurses, and it's not just our staff that's getting sick. It's being home with quarantined kids, things like that. So I agree with everything Becky says, and I'm good for anything that we can do to slow the spread down here in Carroll County.
Hey, real quick, I'm jumping on what Nikki is saying for the rest of the group. So the contact tracers had a public health call. The state of Iowa is making contact tracing calls for 58 counties. 41 counties are doing their own. So we're one of the 41 counties. Between the 9 people at the county and public health level, plus Nikki said 2 more people from the hospital came yesterday. So that would be 11 people, plus 8 school nurses. We have like 19 people working on this. You guys blew through like 55 new cases yesterday, which was awesome. My brother-in-law in Polk County got his positive test last Friday. Today is day 7. No contact trace call from Polk County on him. So the state told us they were behind, but our efforts, being one of the 41 counties doing it ourselves, is way better than what the state is. The state has a complete mess on their hands, in my opinion. So taking it back and getting the 9 people going when we did, thank God we did that when we did, Dean. So we really appreciate the supervisors jumping on that, because it has been a freight train out of control for the last 3 weeks. So just wanted to add that in.
Well, thank you to you guys for doing such a great job. We knew what we had to do, and we went about the right way of doing it. So we just have to continue to do the right thing.
Does anybody else have anything to add? Do you want me to bring up my screen again to go over the statement that I put together, and maybe we can discuss that and decide whether this is something that we want to move forward with publicly releasing?
I have a question. So are we just going to continue to recommend masks, or are we going to actually do something that has teeth? Because we continue to recommend masks and nobody's doing it. So we're at a critical mass right now, but we just keep telling people the same thing. I mean, Greene County just voted to mandate masks. I think this is serious enough that we need to actually put some teeth into that. I mean, we don't have to arrest everybody for not wearing a mask, but people should expect to put a mask on when they go into a business. I mean, we got to start putting those places down.
I agree, Dr. Heim. We've been recommending and suggesting and recommending more mask use from the beginning, and I think it's gotten worse. Less and less people are wearing masks. You know, you go to Walmart, it's masks are required, but now that no one's standing at the door, 50% of people don't have masks on.
Dean, do you want to discuss, there was a method to the madness here, Dr. Heim, with why I put this presentation together. I'm going to turn this over for Dean to discuss tomorrow morning. And do you want to give an update, Dean, on what's going on tomorrow?
We're having a special COVID meeting, supervisors, to discuss what we're talking about. And there have been other counties that have implemented a mask mandate. Probably the best analogy that I can give is I had a discussion with the deputy auditor and the chairman of the board of supervisors of Harrison County, who put one into effect. I think it was probably it was a week ago yesterday, or maybe it could have been the Wednesday before that. I'm not sure. Anyway, the meeting when they actually did it was not very well received. It was, I think they had about 30 people at that meeting. And however, what they did implement on a 3-to-1 vote of the supervisors was a mask mandate, non-enforceable. And so, they're not arresting anybody. They're not giving any fines out or anything like that. And I said, well, how do you think that's going? And he said, well, he said, it's, to your point, Dr. Heim, it's the strongest recommendation that you can give, probably. We've been recommending things, but now it's a mandate, so that maybe that the public will, if someone's not wearing a mask, maybe somebody will say to them, don't you know, there's a mask mandate. You're supposed to be wearing a mask. So that's kind of what he thought happened, was that the public took it then, and they are making their fellow county residents accountable. They're making them accountable to wear a mask. So I'm not sure what we're going to come up with tomorrow morning, or if we're going to come up with anything tomorrow morning. But I've heard a lot of, out of Harrison County, one of the things that they said was the county auditor contacted COVID-19 was a positive case a week before the election. But luckily enough, her staff could stay and run the election because they had worn masks all the time. So all the time around her, they could carry on. And their treasurer over there was was a positive case as well. She was in and out of the hospital for twice, and her husband was in the hospital for 45 days. So it was easy. It was easier for them because they had so much real personal contact, with the COVID. The other thing is the chairman of the Board of Health in Harrison County is a doctor, and he said when his primary concern was, I've seen too many of my patients die. And I don't know what else you need.
Does it have to come from the Board of Health or the Board of Supervisors, or can it come from the Board of Health, or both? Like, does one trump the other?
Heather, do you want to clarify that?
Yep. Can you hear me okay, Becky?
Yep.
In order for it to be a county ordinance, it needs to go through the supervisors. So I think that's the only item on their agenda tomorrow. So I'm sure that they've been in contact with the county attorney and will get guidance on what that process will look like. Board of Health can make recommendations, what they feel is important for the health of your community to the supervisors. And then hopefully the supervisors will take that into account as they move forward.
Because what I'm hearing is like if the supervisors do it, then that would allow businesses to feel comfortable doing it, because it's what we've been having this whole time is nobody wants to make a move. Fairway doesn't want to do it if Hy-Vee's not going to do it, you know. But if you put it out there and the courthouse has it that their employees are going to wear masks, then the city of Carroll follows suit. Then this business follows suit. So I still think it needs to go out there, and then no one is scared to be on that island by themselves and be the business. Oh, then I'm just going to take my business over here. So I do think, like Dean said, even if it's not enforceable, I think we're going to get more community unity and have more places put the sign on the door that says mask required for entry.
You know, the other thing is we have this percentage of positives over the past 2 weeks. 2 days this week that I worked, Monday and Tuesday in the urgent care, my positivity rate was over 50%. Okay,
Yikes.
so that's a real number in 2 days in the urgent care. So I think, I mean, that 14-day total lags a little bit about what we're actually seeing this week as far as positivity.
I agree. And even any move made tomorrow, we're not going to see the results of for 2 to 3 weeks.
Oh,
But,
wow.
and I had hoped to project some numbers to show how, with our current trends, where we'd be sitting at for total numbers by Thanksgiving Day and by Christmas Day. But statistically speaking, we want to make sure they're 100% valid and foolproof, so we don't quite have those numbers yet. But if you just looked off of a real basic assumption from just the average number that we've had in the month of November, we have what, over 300 and some this month. We'll have another 700 if we continue at this average daily rate, not even taking acceleration. We'll have another full 1,000 by the first week of December. So if these statistics that were presented at the beginning of this meeting don't change opinions or don't catch attention or don't potentially change behaviors, I'm just not sure what more we could do, because we'll lose complete control and schools are going to need to be shut down. And like I mentioned, I don't even know how many businesses. I wish I could see a total spreadsheet of how many are shut down in Carroll County right now, not because someone went up to them and said, you need to shut down, but because they have their own outbreak amongst their staff and they don't have anybody well enough that can run the business, or they don't have childcare and they can't go to work.
And I think
the trickle
I think
effects.
we need to really push the last portion of the proclamation that says businesses really need to go back to working from home. 50% people. I know that the treasurer's office reached out to me last night and she got 3 people out. So she was like, we're not going to be able to do driver's license. We are not. I want a mask mandate in the county so that we can continue. If everybody wants business to keep going and schools to keep going, we need these mask mandates in place, or it's going to be shut down all on its own. It's going to be shut down all on its own.
Is that your comment, or is that coming from the treasurer?
It's coming from the treasurer. She emailed me.
Okay.
So she's got 3 people out. She wants masks for employees and for people coming in, or they can't keep going.
Well, and we're talking about people not being able to go to work and stuff like that, and the schools issues and daycare. But probably, in the forum, which is a very good forum that the hospital put on here a while back, the comment that, well, how bad? What is really bad? And I can't remember what doctor it was, said, well, when there's no more hospital beds, when there's, that is the scary part, is when there's no more hospital beds, that's when people start dying. Mm-hmm. And we haven't, although we had 2 more just in the last day. Is that correct? Deaths in the last day.
Yes.
I think it's up
Yep.
to 16 now. So I mean, this will just, I think will just snowball if we don't get it under control. I think the deaths are the most scary part for me.
Can I just add, I looked on Domo, and right now it says that we're 37 days to double our cases. So it'll only take a month and we'll double what we have right now.
And,
Going
and
by
that's from our cumulative total, Nikki, of 1,600.
Yes.
That is scary.
So, and yeah, 1 month we'll have 1,600 more cases.
The other thing is, you know, beds are one thing, but, you know, we won't have capacity to see the patients either. So, you know, people are wanting to get in and get seen, but we only have so much capacity. So, you know, if you get sick enough to need a hospital bed, God forbid there isn't one there, but also, you know, just having a doctor available or nurse available to take care of these people when they get sick.
Yeah, this is definitely not a good situation for Carroll County right now. Do you guys want me to bring this statement up? Do we want to look that over and see if that's
Yeah.
something then we want to formally release? Or, and please, I just, you know, kind of whipped this up. So I'll just go ahead and read it, and you just tell me, you know, things that should be taken out, changed, added in. I just put, due to substantial community spread of COVID-19 in Carroll County that is impacting daycare accessibility, safety of nursing home residents, availability of healthcare workers, and rapidly shrinking capacity for hospitals across the state, the Carroll County Board of Health is encouraging all residents to increase preventive measures to help slow the spread of disease. Therefore, all county residents are asked to do the following proven and effective preventive measures. Wear a mask in public, stay home if not feeling well, avoid large gatherings, socially distance at 6 feet or greater whenever possible, frequently wash your hands. Furthermore, the Carroll County Board of Health would like to encourage area schools to institute mask requirements for all students and staff to help slow the spread, and ask the Carroll County Board of Supervisors to implement a temporary mask mandate to ensure the safety of our residents in public spaces.
I like how that looks. What's our school situation now? Because Carroll implemented a mask mandate. Who does not have a mandate right now?
I think Carroll and Kemper are the only ones with, right?
Yeah, Manning. So I have one that goes to Manning. They said strongly encourage, but they make. So they didn't use mandate, but masks are required. So Manning is essentially mandated, but I don't know if we get them to change it so that it says mandated, but they said strongly encouraged, but I know they're doing it. Coon Rapids and Glidden are pretty lax. So we would have to put some pressure on them. I have one comment about the schools, because we talked to the hospital, and the hospital wanted to see us do some sort of recommendation that the schools go online for 2 weeks. And the school said they had no interest in doing that. They want to keep the kids in school. The only one really doing a hybrid is Carroll High, and they go every other day. Well, what Manning and Coon and Audubon have done was the 4-1, where they go Monday, Tuesday, off on Wednesday, Thursday, Friday. And they pushed that through to the end, I think the end of the second quarter. I think they extended it now. It helps get those kids out of school at least 1 day a week. It forces those teachers to do the online lessons so that moving to online isn't so scary. The parents only have to deal with it for now, 1 day a week. It limits the exposure to 20% of the week. And then on the hybrid, they're suggesting, instead of the kids going every other week, just think of that, about that exposure. They're going every other week. They're saying if you're gonna do the hybrid, do Monday, Tuesday, one group of kids, everybody's off on Wednesday, whatever, and then Thursday, Friday is the second group of kids. Make sense? So you have the same germs in the building for 2 days in a row. The every other day thing all what it's doing is germing up the entire facility every other day with a different group of kids. So they were like, well, we really never got that recommendation on the return to learn. And I was like, well, because we didn't look at anybody else's return to learns. Each district just kind of did their own thing. But now how we're seeing other schools doing it, the schools in Des Moines, they acted quickly. They had emergency school board meetings on Wednesday and they moved to online. They didn't even ponder the hybrid. They just moved straight to online starting Monday. We are at full with the mask just being implemented. So I don't know if we should maybe suggest this 4-1 as a start. And then if schools go to hybrid, coming from the Board of Health, we are explaining the whole Monday, Tuesday thing, Thursday, Friday. Does that make sense to everybody? Instead of the every other germ it all up with kids every other day.
I'm not sure that that the surface germ issue is significant enough to say that they have to be there 2 days in a row. So I'm not sure if that's based on scientific information or just anecdotal. I think the purpose they were wanting to do was just get those kids spaced out so that they could. The other problem is when they're half in, half out, a lot of the kids aren't necessarily doing as well that way. So I'm not sure if from a germ standpoint, there's a whole lot of evidence that those surfaces are much worse if you're going every other day versus 2 days in a row. So I'm not sure what the statistics are there.
Okay. Does anybody have any suggestions, other suggestions for changes in this statement or anything else you want to see in there?
Well, is that statement similar to what's been stated by the hospital, the state health department? I mean, we're just repeating the statement again, which is fine, coming from more different sources. Somebody mentioned earlier about approaching businesses maybe and asking them to put signs on their doors of mask required and things like that. That might be another avenue to think about, is approaching businesses in the county and see if we get more cooperation from that. We're actually out of the area and going in a lot of different establishments, and a lot of them have those on there, and out of respect for them, we put our mask on, and I think almost everybody else was as well. And I think requiring masks for the general public as a mandate, I think would be tough to enforce. And I think you might get just as much cooperation if you concentrate on businesses and have them see if they could, say, please wear a mask in our business.
The only issue, Art, with that is that we just don't have any manpower right now to be able to make those calls or to go one-on-one. There's the workload of probably a staff of 20 within the public health department, and there's about 1.25 FTE. It's very overwhelming right now. And I agree, if you could have those just go knock on the door, kind of those types of discussions, you get farther with that grassroots effort, but we just don't have the capacity to do that. And we need to make a bigger impact. So I guess with your question on the statement, it is a repeat of a lot of the same information that's been said over and over and over. It's just the point at the end that we're asking schools, that it's officially coming from the Board of Health asking the schools, and that we're asking the supervisors. And from conversations with other individuals, it appears that some people in the county are looking for this, that there's something that's in writing that says the Board of Health specifically is asking for this or suggesting this.
So I think I like the statement as it is, because what I'm reading is that we're recommending people wear masks, and at the end we're saying we want schools to mandate masks and we want a mask mandate. I mean, I think that's, we're not going to throw people in jail, but people will get a mask if they're not wearing one. And I've been to other counties and other parts of, Missouri and other places and required, and people just wear them. It's just not that big a deal. I mean, there are people who fight you tooth and nail, but at the end of the day, it's what needs to happen if we want to continue to have our economy moving forward. Otherwise, we're going to be on a lockdown again.
I guess to comment on Art's comment, in a way, I think that the businesses like the Fairway and the Hy-Vees they don't want to make that call themselves. They're waiting for somebody to make that call for them so that, okay, this is the way it is. We're just abiding by the rules, and I think a little bit of, the governor too, is the governor just allowing the counties to do their own thing. They're going to make the call, not me, type of. So I don't know. I think that it's tough for the supervisors to do. I don't like it because I know that I'm going to get a lot of phone calls, and I know that people are not going to be happy because in these other supervisor meetings where this has gone on, that's been the case. But I think that's what the businesses are faced with if they implement a mask mandate. I was at Walmart here. This is when they actually started. And I was going into Walmart and a guy pulled up in a pickup and he asked me, are you required to wear a mask in there? And I said, yes. But if you don't have one, they have some at the door. And he said, no, that's not the point. And he drove off. So we're going to have people that are not going to be happy. And I think that's what a lot of businesses are facing too. I mean, they don't want to make their customers upset. However, if somebody else takes the heat, they're okay with it. They're probably okay with it, today, but they don't want to take the heat.
Dean, I just think,
fair statement.
Yeah, but I think, one simple response could be, I'd rather have you angry with me than going to your funeral. This is what public health is about. Public health is trying to do, looking at research, looking at data, weighing evidence, and making recommendations that can save as many lives as possible. This has been something that's been a part of our country for over 150 years. If we didn't have public health making recommendations that were based upon solid study, we wouldn't have clean drinking water. We wouldn't have seatbelts in vehicles. We wouldn't have child car seats. And there wouldn't be laws against drinking and driving. This falls right in line with all of those other endeavors. So I know it became political, and that's just a shame. But I really think that this is our role right now. Based upon what we are seeing in the county, I don't think we can sit here and worry too much about how many people it's going to offend or make mad, because our numbers are spiking so out of control that if we didn't do something, it would be 100 times. So I guess with that, Julie, did you have something?
Yeah, I just wanted to say I gotta leave here pretty soon because I gotta test people here for COVID here shortly. But I like your thing that you wrote up. I just kind of wonder, instead of just singling out the schools, maybe we should add businesses and schools. It's a recommendation. And like Dean said, the businesses are maybe looking to have someone make the decision. Maybe we should add businesses and schools and just change that wording a little bit. That's just my opinion, but otherwise I think it looks real good and I'm in favor of it. I think we should do a mandate, and I'm going to have to leave here shortly, unfortunately, but I just wanted to put my opinion in there for you.
Okay, yeah, good suggestion. Thank you, Julie.
Mm-hmm.
Anybody else?
So in case it comes to a vote, Julie, you would vote yes.
I would vote yes.
Okay.
Any other discussion? Okay, I guess, does somebody want to make a motion to release the statement with the amendment that Julie suggested of adding in businesses along with schools?
I'll make a motion.
I'll second.
Okay, any discussion? All right, all in
So
favor? say-
we're just recommending this. We're not saying it has to be a mask mandate. Is that right?
We are making the recommendation that the Board of Supervisors implement a temporary mask mandate. Yes.
Without penalties or whatever we called it. What was it?
Enforcement, well, that would
Yeah.
be for the supervisors to discuss. I don't
Okay,
want to put the caveats in there of how they should,
Okay.
put that together. But I think if we just leave it as this is our recommendation that this should be in place, and how you structure that is up to them, I believe.
okay.
Okay, so we have a motion, we have a second. All in favor of releasing that statement to the public, say aye.
Aye.
Okay, all opposed?
Opposed.
Do I need to abstain?
Um,
Because I'm part of that, I mean, I'm not saying I'm not for it, but I think as far as the vote is concerned, maybe I should abstain because you're directing it to the county supervisors, of which I am one.
okay,
Does that make any sense at all?
yep. So let's just go back through and do a roll call individual vote then. Say aye or nay. Okay, Julie?
Aye.
Dean is abstaining. Dr. Heim?
Aye.
Art?
No.
Okay, and Becky, I'll be aye. So that'll be a 3-1 with Dean abstaining. Okay. All right. Nikki and Sarah, if you guys want to take over. I know we had added on the agenda the review of the isolation quarantine guidelines, just as we thought it would be a good reminder again for everyone to hear. And then any other updates that you have.
Yeah, let me pull that back up. Just, you wanted to talk about the one that the governor put out? The quarantine?
I think just a reminder, because as we've talked about with the local contact tracing, when people are making phone calls, they're talking with individuals that say, well, my boss said that I could just get a negative test and I can come back to work, or just kind of reiterating that information that I know that you guys have already been putting out in the public, but just a repeat again today that we can continue to educate people on what the appropriate guidelines are.
Yep. So anyone with a positive COVID test, they have to isolate 10 days from when their symptoms started. If they did not have symptoms, it would be 10 days from their test date. That means isolate in your home, away from hopefully everyone else in your household. And then anyone that you were in contact with 48 hours prior to symptoms starting or prior to your test would be then considered exposed to, and then they should isolate 14 days from last exposure date. So, and then, there's cases where families can't isolate away from the kids or vice versa. So then it would be a 24-day quarantine period for them. And then if someone is immunocompromised, it's a 20-day, just to make sure that they, get over and handle the illness well. So, it's important to follow those guidelines just so we're not spreading it further and further and further. I know nobody wants to stay home for 14 days, but it's what we need to do to get our numbers down and, keep people from getting sick.
Great, thank you. If you guys want to move into your stats and financials.
Just our stats, we're kind of still holding off on foot clinics. We're doing more of those, and now that the assisted livings and things are kind of tightening back up, we've decreased those. We finished up with our flu season. We gave about 1,500 vaccines this year. So that was good. It seems a lot of people were getting them earlier this year. So just still in stressing the importance of getting the flu shots, we still have some available. So we do still have people trickling in to get those. And yeah, just stressing the importance of everyone getting it this year.
I have one question on the flu vaccine. I saw in the Winnebago County paper that Winnebago County Public Health had no high potency flu vaccine. Is there a shortage of that, or what? Is there enough flu vaccine around for everyone?
I know that there was trouble getting the high dose vaccine, but we were able to get a big portion of them, and we did administer all of those. I'm not sure that we have any high dose left. I would have to check on that.
Okay.
Hey, can you guys hear me? This is Sarah.
Yes.
So yeah, we had about 100 doses of the high dose. It went really fast, and we had a hard time getting in any more doses. Currently, public health, we are still out of the high dose flu vaccine. Dr. Heim, I'm not sure if you guys were able to get any more in at the clinic, or what your supply looks like on that.
You know what? I'm not really sure. I just got an email not too long ago and I can't remember what it was. Let me see here. Let's see. I mean, I feel like we got a supply for a minute there. We've been having a lot of people are signing up for flu shots, but I think we got a much higher enrollment in our flu clinics than we've had before. Let's see. We got regular dose. We got 300 more high dose last week. So looks like we got quite a bit.
Is there quite a bit of difference between the high dose and the regular dose?
We like to give the high dose to older people, just they get a better response that way, better coverage.
Okay, anything else from public health nursing or any other questions for Nikki or Sarah? Take that as a no. All right, let's move along. New opportunities. Paula.
Hello. I just was going to give a brief update because I know you guys have had bigger things to deal with than what we all have going on. So I did have Megan just send out an update. It was just kind of our numbers since we just ended our actual fiscal year, the end of September. Our biggest thing is we are still continuing to provide services by telephone. The USDA has that waiver in place through February of 2021. So we are doing things by phone. We did actually yesterday move our staff more home. We have very limited staff in the office just to try to keep people, I mean, we've had masks on in our mask mandate in our office from day one, but just trying to eliminate so much traffic in our building. So we do have most of our staff at home. And we are still just providing services over the telephone. And if you look at the numbers, you can see that we can see a direct correlation of increase in our WIC numbers since COVID has started. So we continue to reach out there and try to contact all the families that may be in need of some additional support right now, especially with financial impacts of COVID. So we are working extensively with like our Head Start or Early Head Start, just double checking all of our lists to make sure that we're reaching out to anybody we can really get on to WIC at this time. We are required to hold our Title X family planning clinics. So we are still continuing to offer them. We can do some stuff by telehealth, but some of it's kind of hard to do. We have seen a little bit of uptake in our family planning, and mostly we've had a couple of referrals from local providers and clinics because they're just having trouble accommodating all the appointment times. So I know some of our women have been like, I couldn't get an appointment for 3 months. And so their provider recommended that they come out to us, which is great. We can fill that gap while our clinics are busy doing other things, and we can kind of do all the STD and birth control options and that for those women. So that's actually been great, and it's worked really nice. So the only other thing I had Megan send out, and I know it's not some of the floats to the top, and now it's officially probably a little farther away off, but it is the proposed collaborative service areas that are out there. And actually it's not technically proposed anymore. I think it's a final map that I shared with you. So it does significantly change our service area. But that impact is not until 2022. And I'm hoping I'll be retired by then maybe, or find some miraculous. I'm too old to go through all these changes all the time. But so that's a long ways down the road. But does anybody have any questions?
But geographically, it seems like it makes sense.
Yeah, I think I like the geographic. When they changed the map, they took Sac and Calhoun away from us again, which just moved us into another situation. We were already the smallest service area providing services in the state of Iowa, and it just it dropped us by almost over 2,000 additional people. That makes it pretty hard to financially make a program stable. That's just the reality of it. So I was extremely disappointed that they took the smallest service area in Iowa and made it even smaller. And the unfortunate component of what went on is there is no feedback or input with the final map that was released. So people were able to give input and feedback to the proposed map for approximately 14 days. There was no feedback opportunity once the additional changes were made.
Well, that's no good.
No. My opinion.
The only question I have, Polly, is that your prom dress hanging over the door?
I get that on all my Zoom meetings. I keep saying I need to put that somewhere else. It is the beautiful Elsa dress that Elsa has, been so much out in the community that hangs on my back door. I do not wear it, nor would I fit in it.
All right. Anything else, Paula?
No, I just want to thank you guys for everything you're doing. Amen, Becky, for mask mandate. I tell my story everywhere I go, but our most recent one is, it isn't just about hospital beds. It is about your staff and your nursing staff. Mariah and I have been trying to help out with nurses and babysitting with kids that are been quarantined out of the child care center. So yeah, she's been pretty committed trying to do nursing school and cover lots of nurses that are trying to work with having their kids at home. And I know that we're seeing our nurses test positive, so it's coming.
That's a very good point.
Yeah, it's tough for our parents, and especially ones that are in jobs where there's not a flexibility of them being at home. So yeah, if you find someone in desperate need, Ryan, I've been trying to help out in those situations.
Well, that's good to hear.
Yeah.
Thanks, Paula.
Yep.
Okay, Carrie, environmental health.
Okay, I can be really quick. I was not able to get monthly reports sent to you. I sent you an email about it. I will get those out as soon as I can. Then we can discuss them at the next meeting. You don't approve those anyway, they're just for your review. I did get the claims to you. Did everybody get those? So if you want to approve or not approve my claims today, that would be great if you approve them. Not approve them.
I just got to look through my papers on the claims.
Or if you want to
Yes. Okay.
January, it could take on until January. Obviously, they've already been paid by then.
I didn't catch that, Carrie. What was that?
If you want to table them until the next meeting, that's up to you also, but they've already been paid.
I think we still have a quorum. Dr. Heim had to step out, Julie had to step out, but Art's still on the phone, Dean. Yeah, I didn't see anything on there. I guess if one of you two want to make a motion to approve if you reviewed them.
I'll make a motion to approve.
And I'll second that.
All right, all in favor, aye. say
Aye.
aye. Aye. Okay, all right. So that'd be for September, October, and November approved.
The only other thing I have just is that we did hire somebody to do a perk test for us. We have not had too many roll in as of late, which is surprising a little bit, because usually this time of year is when we get bombarded with perk test results. So he hasn't been able to do too many, but we are going back to permitting with the perk test requirement. That's all I got.
Okay.
Anybody have any questions for Carrie?
No.
All right, let's move along to Megan.
All right, I sent my September and October reports and claims as well. So if there's any questions on the reports, otherwise I'll just leave the claims approved as well.
Okay, I'd make a motion to approve the report as presented.
And I'll second that.
Becky, you're muted.
Sorry, I was scrolling through, looking over the reports real quick, or the claims real quick. I hadn't looked at them, but we had a motion and a second. All in favor of approving those, say aye.
Did you just approve the report or the claims as well? I thought I heard report.
So
Go ahead.
I just need the approval for the claims.
Okay,
Okay,
that's what you, and I seconded that.
The claims, yep.
Right.
And we all in favor of approving the claims as presented, say aye.
Right.
aye.
All right, we got it. Okay. Anything else, Megan?
That's all I have.
And Megan's been pulling double duty as well with taking care of home care aides during the day, and then lots of afternoons when she gets off of work, going back in and making calls for contact tracing too. So.
And thank you for that. Great job.
Yes, thank you, Megan.
Welcome.
All right, I think that's everything on our agenda. Does anybody have anything else?
Well, I just like to say, hopefully, we're going to have to go through this one way or another. Hopefully we're at maybe a peak and things start to slow down. I'm kind of a believer in herd immunity. And a vaccine sounds like it's fairly close. So I'm hoping that we're close to a peak of severity.
Hey, Sarah, do you have information on if this is herd immunity or not? I know we've talked about that earlier, and I didn't think this particular thing is herd immunity.
I think it'd be real hard to achieve herd immunity. At the town hall meeting that we had the other day, Dr. Collison was talking about how 70% of the population would have to actually be infected, and they, according to the professionals on that panel, the risk outweighs the benefit for any type of herd immunity because too many people would die.
So with the vaccine, that's the most logical way to accomplish herd immunity, correct, Sarah?
Right. That
So
would be the
you
best way.
did comment on the Emergency Coalition meeting last Friday that you are preparing to do vaccinations, correct?
Yes. We are.
So what is the
planning.
likelihood that you're going to have vaccine by the end of November?
I know they're talking end of November, mid-December, hopefully getting our first allotment of vaccine.
So I think there's two of them, there's Madeira and there's Pfizer that are the closest to being approved. Is that correct?
Yes, Pfizer,
And
I know
so-
for sure.
So do you have any choice over which one you can get? Or do you take what you get type of
We
thing?
take what we get pretty much.
Okay. Because the Pfizer is a 2-dose.
I believe all of them are 2-dose vaccine.
Well, I think the Madeira, they said that was a 1-dose. Maybe I'm wrong there. Okay, I could be wrong.
I believe they're both 2 doses. One's 28 days in between and one's 21 days.
Okay. All right.
How about storage of the vaccine? Is that going to be an issue?
Well, I believe the Pfizer one, it's a sub-zero. It's like a 60 to 80 degree below zero. We're working out those kinks.
Okay.
But it can be refrigerated after frozen for 5 days, correct? So you got 5 days to move it after you bring it out? Is that
5
correct?
hours. 5 hours.
5 hours?
Yes.
Oh, I thought it was 5 days.
After
I was hoping
after,
it was 5 days.
no, after it's been reconstituted and taken out, it's only 5 hours, 5 to 6 hours.
Okay.
That's why this is going to be a big strain on them, staff wise.
Yeah, obviously, if we get doses at even in December, it's going to go to the top tiers, long-term care residents, healthcare workers. It'll be late 2021 before general public probably has the vaccine.
There was some new guidance today that I saw from the state that listed all of those that would get priority for vaccine when it got here.
Yeah, did that come out this morning? I haven't looked at it yet, but I know they talked about it on our Tuesday meeting that they were working on that to see how many doses per county would need.
All right.
I didn't get in on the first part of the meeting there. I was having trouble linking in, but flu vaccinations, are they higher? More people getting flu vaccinations compared to other years? And number of flu cases, any report on anything there?
I think we gave about the same as last year, but I think we gave them a lot earlier. People were wanting them earlier this year than in the past.
Okay.
But I think average we gave about the same, but in a normal year we would have given more because we missed out on a couple of the school vaccine clinics where we catch a lot of kids and parents at conferences. And since conferences were virtual, we didn't do that this year. And as far as influenza, there's not much in the state. I know McFarland did have one patient with influenza recently, but not much activity there yet. Hopefully we don't see much activity like other places due to masks and good hand hygiene and things like that.
So Becky, is this, did you say this was going to be accessible to the public on YouTube? Is that correct?
Yeah, all of these meetings always are.
Okay.
Was my understanding when it goes virtual that I think you can just search on YouTube and watch it.
Okay. All right.
Okay. Anybody have anything else? All right. Well, I'll make that revision on that statement, and then I'll email to Sarah and Nikki if you could put up on the public health Facebook page, and then we'll make it public from there.
We can do
sound like a
that.
plan?
Yep. Thank you.
All right. Sounds good. Okay. Well, thanks everybody, and
Stay safe.
Thank you.
keep on keeping on.
Motion to adjourn.
Oh yeah. Yep. Hey, can I have a motion to adjourn?
So
Dr.
moved.
Art?
Second.
Okay. All in favor to adjourn, say aye.
All right.
Aye.
Okay. Thanks for keeping me in line.